But first here, October is Breast Cancer Awareness Month, and we all know scheduling a mammogram is very important. But during the week, of course, things get busy. Hillcrest Hospital wants to help make scheduling the appointment easier on women. So we're joined now by Dr. Clint Merritt at Hillcrest Hospital South, which is offering Saturday mammogram appointments throughout the year to make it a lot easier for people. Dr. Merritt, thank you so much for being here. Let's start by talking about those appointments. When can people come in, and can you tell us why Saturday was added as an option here?
Yeah, sure. So I'm down at Hillcrest South at 91st and Mingo, and we added Saturday morning mammography clinic, mainly to focus on the people, the patients who have a hard time getting time off work during the week, or too busy during the week for whatever the reason, to come Monday through Friday. And these Saturday morning clinics are excellent to free up some time to do something that's very important. Here at Hillcrest South, we offer mammogram screenings every Saturday from 8 to 11:30.
Awesome, Dr. Merritt. So can you talk real quick about the importance of getting mammograms? Why do you need to do it, and when do you need to start getting them? What's that recommended age?
Sure, yeah. So mammograms, obviously one of the most important tools we use in the detection of breast cancer. Not the only tool, but a very important tool. As far as timing on when to begin mammography screening, there's some nuance to that. I tell my patients every woman needs to have a breast risk evaluation, usually beginning at the age of 30. And what that means is you come in, you see your primary care doctor or a doctor familiar with breast health, and they ask you a few questions, mainly pertaining to your own personal history, family history, any breast procedures you've had in the past. And what they do is they calculate a risk percentage for lifetime development of breast cancer. If you fall in a high risk category, which would mean a breast cancer risk, lifetime risk of greater than 20% for the development of breast cancer, you will likely be recommended to start mammography screening earlier. But if you are a standard risk patient, the average risk or time that we start mammography screening would be at the age of 40.
Great, Dr. Merritt. Can you talk about some expectations people can have, when they're going into that appointment? If you're, especially if your first time, what can you expect when you're there?
Sure. First of all, don't be nervous. The staff that we have here in the clinic are very well trained. They all know the concerns that most patients have, and so they can address those as soon as you walk in the front door. It only takes 20 minutes from walk in to walk out to get a screening mammogram done. I'm actually standing right here next to one of our 3D hologic mammograms, one of the newest technologies on the market. And so it's very painless. It's some slight compression to the breast in a few different angles. Get really great shots of the breast tissue that a radiologist will then review and then make sure that there's nothing concerning that needs to be imaged further.
Great advice there, Dr. Merritt. And real quick here, just for anybody that's curious or wondering, I'm sure you guys have seen situations where these have really saved lives, but what else do you want to say to anybody who's watching about just the importance of this and the fact that you guys do have this option available?
Yeah, sure. So the biggest thing is just make sure that you're on time, especially with that first mammogram. I see a lot of women in my breast surgery clinic who will come to me and they have had their first screening mammogram at 47, 48, even 50. And unfortunately, there's an abnormality that probably could have been detected months or years earlier had they been on time with their mammography. And so at minimum, even a normal mammogram, we typically recommend once you're at the age of 40, you get a new mammogram every year so that if a new abnormality does arise, we're going to catch that early and increase the survival odds of beating whatever's going on in the breast.
Dr. Merritt, thank you so much for being here with us for this really important advice here. We really appreciate your time. And some details now for you guys. Hillcrest Hospital South, of course, is offering Saturday mammogram screenings through the end of the year. Appointments are available between 8 a.m. to 11:30 a.m., as you heard there. In addition to Hillcrest South, Hillcrest Medical Center on Utica has appointments available today and in the future based on need. You can go and schedule your appointment online by visiting the link on the screen right there for you.